Tuisonga na mbele, Silikali yiweta enenthi milioni 13 kuvikia ooyu ni aandikithye na walan'yo mweu wa uiiti wa SHA. Vala kuvikia ooyu Silikali inenganite kimanza cha bilioni 9 nokana kutetheesya kwailya muvango Silingi bilioni 1 iithi muvangoni walinda mama. Ono wiovo Muneeni wa Silikali Isaac Mwaura niwatetea walan'yo wa Silikali wa kuthukumana na atandithya kiimbene mivangoni minene ya Silikali ta Ngwatanio na Kambuni wa Adani. Yiweta vena vaita munene kwa mwenenthi vandu va Silikali kulika Ngwatanio. Benjamin mwakano kutuelesya.
Silikali ni akadhi ya muvango imbyo wa uiiti wa chief vala yaweta utalwa inenthi ala maende kuiandikithya na walan'yo wa SHA nuvikie milioni 13. Walan'yo wa wendi museo wa inenthi kumantha uiiti wena withianu masivitali ni.
I'm very happy to report that over 13 million Kenyans have registered towards this. So if you are not registered, please join so that you are not left behind. We've already started having deductions from those who are salaried. Even myself, I'm paying about 22,000 shillings, and it's going to a kitty to benefit all Kenyans. Those who are paying 300 shillings and those who are paying as much as myself or even more, we all belong to one country. And that is the equity that comes with this kind of thinking and policy to ensure that all hustlers benefit and beyond.
Kuyanana na Muneeni wa Silikali Isaac Mwaura ni kanambe wa masivitali ngirina na maana imeandikithitye na walan'yo wa SHA tanzemwe ya kuikithya mwenenthi ndana thina ilo kumantha uiiti wina withianu.
We are happy to say that now at least we can register 55 cancer care providers. This is very commendable because we had very few facilities in this regard, and we have also 184 renal care health providers.
Ino wiovo Silikali ni yaweta ni kuendeea kutwika muvango imbya wa uiiti vala kuvikia ooyu Silingi bilioni 9 itumikite bilioni 1 huitumika kwailya kinandu cha uiiti kwa mwitu vitani ya kutetheka cha linda mama.
The government has already paid 9 billion shillings in terms of what was owed to NHIF, the shift to shift. And so we have a balance of 21 billion, which we intend to clear. Of the 9 billion, 1 billion is for the Linda Mama program, because we need to have, safe deliveries. And, this has also been increased in the new program, where you have actually the shift program. You have 10,000 shillings for normal delivery and 30,000 for cesarean.
Mwaura hingi nuwa kadhi ya musukumo wa Silikali kwa ilio thukumi na milati minene ya kimaendeleo kuisila Ngwatanio na atandithya kiimbene yani PPs wao yumetuke ne wa Adani nthino wa kwailya kiwanza cha JKA na unaichano wa stima kuisila wiwano na Kambuni wake Trako.
Today's economic challenges make it essential for Kenya to embrace PPPs as an alternative to traditional financing models, and it is also anchored in law. It's good to say that. We passed that in the 12th Parliament. Beyond infrastructure, PPPs offer Kenya many advantages. These advantages include the reduction of public debt, as the government can allocate resources to other priorities, while the private sector shares projects risks. The private sector efficiency also, the private sector is always ahead of government in many ways and also more efficient. And modern management practices make PPPs more cost-effective, delivering high-quality services and ensuring better value for Kenyans.
Vilingo wa mauvo kumupamusi nilovi yanita wa Benjamin Mwakam.